Do you really need surgery if you have rotator cuff tear? The answer might surprise you. It depends. So if you've been experiencing shoulder pain on one side and having hard time reaching up, and you've gone to the doctor and you had imaging, and the doctor told you that you have rotator cuff tear. So now you're in a process of getting to see the surgeon, or maybe you have seen the surgeon, and the surgeon asks you to perhaps propose a surgical solution for you so that you can repair the torn rotator cuff tendon. But do you really need that? So this video might shock you. So the reality is yes and no. And here's why. Just because you have rotator cuff tear, and same as many millions other people who have rotator cuff tear but have zero symptoms. And here's why. So look at our shoulder here. Our shoulder have three different bones. We have a clavicle, scapula, and the humerus. The rotator cuff muscles, it's a group of 4 different muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. 4 different muscles cooperate the shoulder together so that your shoulder can do external and internal rotation. Okay? Now, just because you have shoulder pain and having difficulty reaching up and happen to find that you have rotator cuff tear doesn't mean that the pain comes from rotator cuff. So now I'm going to show you one drill that you can help release some of the impossible impingement syndrome that often get misdiagnosed as rotator cuff tear. Well, this one you might need a tool. You need a dowel or something longer that you can dig into your armpit. Now I want you to find this subscapularis muscle, which is located on the back of the shoulder blade here. Now, so in practicality, this is how you do it. So first of all, find the armpit, and second, use a dowel or finger if you can't, and you need to dig into the subscapularis muscle. When you dig in there, you will feel like a deep ache. At the same time, I want you to internal and external rotate your shoulder for about 15 seconds until you get that muscle release. And after that, give it a try. If your shoulder get more range of motions, likely you probably don't need to do surgery.